Medical professionals, what's the most obvious case of faking it you've witnessed? We have a patient at our primary care clinic who claims to be blind. He always comes in with sunglasses and a white cane. We were always suspicious, though. Something definitely seemed off. One day, someone followed him out of the building. He walked through our nearly empty parking lot and down the street a little ways to a car parked out of the view of the clinic. He folded up his cane, got into the driver's seat, and emerged into traffic and just drove away. Who is out here pretending to be blind? I wish I ran into that guy. I accidentally dumped a box full of Raisinets all over a blind guy recently. I wish he was faking it. I felt so bad. Not that it's okay to dump candy on someone who's not visually impaired, but you get what I'm saying. Next story. Veterinarian here for something different. Performed a cruciate repair on a miniature poodle. And of course, the dog limped post-op. Came in for radiographs a month later to confirm healing. Looked great, but the dog was still limping. 2 months later, the owner was furious that the surgery was a waste of $1,000, threatened to sue. But on examination and re-radiographing the leg, I couldn't find a thing wrong. On a hunch, I asked the owner to leave the dog with me for additional tests. That would be, of course, no cost to her, so she went shopping for an hour. During that time, I set up a video camera to record the dog in the kennel run. The moment the dog didn't hear the owner or the car anymore, boom, all 4 legs working like a charm, dog running around perfectly normal. Called the owner and asked her to return about half an hour. Set the camera to record again, and the moment the dog heard the familiar car returning, the limp came back as well. I had a fun few minutes explaining to the owner that her dog was faking the sore leg for attention. Got the usual, "Oh no, my fur baby Schnooky Wookie Wookums wouldn't do such a thing." So I showed her the footage, clearly showing her dog running around fine, as well as showing what happened when her car returned. Instructed her to ignore the dog while it was limping, and the limp, hey, magically went away after a week of not getting attention for it. Dude, dogs are so smart. Next story. I had a woman come into triage in labor and delivery. We ruled her for breaking her water. She was upset that she wasn't going to get induced and be delivered. So after I left the room, she flooded the bed, the floor, and herself with tap water. Literally gallons and gallons of water. It was leaking out from under the door. I mean, there was so much water. It was like that scene in Coneheads. She said it was her water breaking. Again, quickly ruled her out and told her she needed to go home. She subsequently peed the bed before leaving. Next story. My mom had a patient who said she had passed kidney stones at home and needed some painkillers. The lady actually brought in the kidney stones as proof. Patients don't usually do this, and the stones were way bigger than people can pass on their own. My mom sent them to the lab, and they came back as geological origin, aka crazy lady picked up some small stones from outside to try and get some meds. Next story. My grandma used to work with a lady at a hospital, funny enough, that would always say she got on the job injury and needed to take a few weeks of workman's comp. A doctor there would somehow always give her a note and she would get a free week or 2 of vacation, come back for a month, do it again, obviously milking the system. One day, her boss said, "Okay, but there's nothing for you to do here on light duty. Usually we'd send you home until you're better, but we're going to have you come in until you're better." "But there's nothing for me to do," she said. He told her, "I know. Bring a magazine or something. It'll be a long day sitting in the break room." She lasted 2 days and never pulled that stunt again. Next story. I posted a while back, but I'll post it here again. It wasn't super obvious at first, but after looking into her records, it became clear. So, this happened a few months ago on my psychiatry rotation in medical school. There was a patient at an inpatient psychiatric facility for self-unalive ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I, also declined the physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on the breasts or vaginal complaints when she visited male-only physicians' offices. We diagnosed her with a factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. Next story. Called to a bar for a seizure. Waitress says she delivered his bill and he suddenly went to the floor having a seizure. Look over at him and he's laying there flopping his arms and legs around, and he looks me right in the eye and screams over and over, "I'm having a seizure." We tell him to stand up so we can take him to the ambulance. He does and starts walking to the door. We told him, "Hold up, gotta pay your bill first." Man, he was upset. Waitress tells us he does this all the time. Well, not today. He still took a ride to the hospital though, but the hospital had some good egg salad sandwiches for him. Next story. My mom had a frequent flyer at the emergency room she worked at. This lady was constantly in unimaginable pain over everything. She got a splinter in her finger and that constituted a 10 on the pain scale, and she needed painkillers to deal with it. She was a known drug abuser as well. She had been caught stealing needles and shoving them under her huge, sweaty boobs. The only reason my mom found out was because she came back in to place the EKG pads, and to do so, she had to lift her boobs up to place the pad. When she did, the needles rolled right out. From that point on, they had to have a member of security watching her anytime a nurse or doctor left the room. She also had a massive arrest record, and there were times the cops would bring her to the ER instead of an ambulance. Next story. When I was a labor nurse, the emergency room sent up a gal who said she was in labor. She was a sturdier lady, so it was hard to tell. No prenatal care, no fetal heart tones. Did an ultrasound. She'd had an hysterectomy. She and her partner insisted we were wrong because they prayed and they knew they were having their miracle baby. Well, good luck with that, ma'am. This person had a long mental health history. I have no doubt that she believed she was pregnant. Next story. Not quite the same thing, but in the ER, a woman came claiming she was in labor, so got her on her way to L&D. L&D sent her back saying she was faking it and needed to go to the psych ward. Quick physical exam showed that was false because the baby was crowning. Sent her back to L&D, and from what we heard, baby was delivered in the hall on the way there. Next story. Not a medical professional, but worked security in an ER. Once had a guy come in, announced that he was going to have a seizure, then laid down slowly and comfortably on the floor and didn't start seizing until he was sure everyone was looking at him. Then when the nurse, who knew he was faking, said they were going to have to run a tube down his throat, he was suddenly fine. It's kind of like when you would stub a finger, a toe, or whatever as a kid. You would be hurt and you wouldn't stop crying. Your dad would go, "Well, if it's still hurting, we probably got to saw it off, huh?" And I go, "Actually, no, it's pretty good," just to get you to shut up. I'm sure everyone's parents did that. I hope. Was effective, though. Next story. Not exactly faking it, but funny story. When I was working in the hospital, a patient's screen with his vital parameters started showing dangerously low levels of oxygen in blood, and one doctor rushed to the patient's room while the CPR mode is active. Surprisingly, the patient was looking all well and didn't show any blue skin, sign of deoxygenated blood, and he was even smiling. So everybody just confusedly went on with their business, except for this one sister that grinned at the old man raising her finger, saying, "Oh, Mr. Smith, did you hold your breath again to see how fast the oxygen levels drop?" And he just started grinning like a 5-year-old and nodded. One of the funniest moments, honestly. Next story. Lady kept putting cut-up plastic pieces up her uterus. Yeah, you read that right. Not in the vagina, the uterus. Wanted to be perceived as a medical mystery. Surgery to remove it. Complains of more plastic coming out hours later. Doc says, "I took pictures. There is no more plastic." Tells her, stop doing it. So she requests a new doctor and another surgery occurs. More plastic. This is called Munchausen factitious disorder, I think. Incredibly frustrating to deal with as a provider. Next story. I was a combat medic in the Army, and faking an illness or injury is extremely common. But I always gave it a pass because unlike any other job anywhere else, getting a sick day is dang near impossible, at least in my unit. So if you came in with a fake cough or told me you had the craps, I would tell our PA to give you 2 days of bed rest. He didn't give an F and did whatever the line medics asked him to. The real crazy crap is from people who you know are faking it and trying to get out on a medical discharge. These are almost always people in their second enlistment because after 4 or 5 years in the Army, they know how the system works. We had a fellow medic do this crap. He was a former Navy corpsman who re-enlisted in the Army as a medic. He was also a real crap bag. Schmoozed with the right people in the platoon, so no one never knew where the F he was half the time. Usually, he was sitting at his house, on base, playing Xbox with his wife. Personally, I'm under the assumption that he re-enlisted solely to fake a service-connected injury so he could get out with full disability. Anyway, we were an infantry unit about a year out from deployment to Iraq when this guy showed up. One day we were holding some training for the Joes using CPR dummies. Some of these dummies were over 150 pounds and used to simulate carrying dead weight. We were moving them around the area when we heard a crash from the other room and a loud scream. We rush in and Navy corpsman was sitting there holding his arm and wincing like he got hit by a truck. He made up some vague story about pulling a muscle when the dummy fell or some crap. For the next month or so, this guy would walk around with his arm, his right arm, held out bent at an elbow L-shaped, with his palm up and his hand frozen like a claw. Imagine your arm in a sling, but twist the hand into a claw and hold it palm up, and now you get the idea. It was effing hilarious. One day, he gave my buddy a ride in his car, and he used his good hand to put his clawed hand on the shift between the seats, and he used his good hand to pull that hand so he could switch to drive. I'm laughing just thinking of my buddy laughing his butt off telling me this story over beers later that night. This effing guy milked that crap for everything it was worth. His fake injury gave him the perfect excuse to F off. I'm at the hospital, or I have an appointment with orthopedics, or some other crap. He eventually did get his medical discharge, which meant he had another reason to F off, because he had all sorts of appointments with the discharged people, and the rest of the platoon was too busy getting ready for combat deployment to babysit his butt, so whatever, right? I always figured that if someone is in the military and wants out, it's better to give them the boot. Keep them in, and all it does is F up morale because all they do is sham and complain. You get an older guy doing this crap, it puts bad thoughts into the younger and newer guys. So F him, get out of here, I don't care. The only thing that bugs me about this guy is that I know that this dude used every piece of knowledge he had, which was actually pretty considerable, to get more disability than dudes who got effed up on combat ops during our deployment. Pro tip, if you're in the military and want to know if someone is effing off, call them up and ask them where they are. 9 out of 10 times they'll ask where you are before answering. That way they can say they're somewhere else. I mean, you don't want to say you're at the company CP when the guy calling you is standing right in front of the company CP. Next story. Pediatrician here. So my patient was younger and I think influenced by mom. The 13-year-old kept getting admitted for complaints that never made sense. A lack of smell, a dizziness, seizures that would happen while he was walking or running. Heart felt hot, etc. Every specialist under the sun had seen him and cleared him. He had every test and imaging study you could think of. There was a lot of social stuff going on, and this was a hard family to discharge. He'd get admitted, we'd run 100 tests, and as soon as we were about to discharge him, some new symptom would come up. The worst was once after I had already written the discharge orders, and the nurses called to let me know the patient had gone blind. I was grouchy that day and wasn't having it. I went in with a rolled up piece of paper, I checked his pupils, I used a Snellen, I went through the whole rigmarole. Then when I was talking to his mother, without looking I threw the paper at him hard and fast. He yelped and dodged it. I told Mom that they were going home. To be honest, I still feel a little guilty about it, and I don't know what the right thing to do was. Think fast! A little unorthodox, right? But it got the results, so now it's wasting less people's time. Also, love the use of rigmarole. You don't hear that often. Next story. I commonly have young kids who really want glasses because some of their friends have them. They'll come in acting like they can barely see the big E on the chart. I change some lenses in front of their eyes, give them a little encouragement that they can see better and they can magically read 20/20 with little to no prescription. They're not big fans when I tell them that they don't really need glasses. Yeah, I was never that kid who wanted the attention with glasses. I mean, I was already loud and annoying enough that I got it on my own, but I didn't want to have bad eyes. In fact, I went out of my way to call everybody who had glasses for eyes. Boy, did that come back to bite me on later. My eyes got terrible. Karma. Next story. Had a PT come in with uncontrolled diabetes. He was type 1. His BSL was really high. A couple days and it was back under control and he was ready to be discharged when they went out of control again. Those patterns continued. About 7 a.m. one morning, his girlfriend fronts me needing a note for the judge. He was supposed to be in court at 8 a.m. He'd been eating wild amounts of food to try to get out of going to court, then wanted us to fix the situation with 1 hour notice. We did nothing. He went home about 11 a.m. Next story. Not a medical professional, but I was thought to have been making my symptoms up. That it was all in my head. 2 years and a mess load of doctors later, turns out I have a muscle disease. So apparently I'm really bad at having a disease, I guess. I know even the doctor that found it thought I was faking it. He did apologize profusely and sent me to a specialist that deals with rare muscle diseases. Next story. I worked as a nurse on a cardiac floor. Chest pain was the biggest thing people would use to drug seek because if nitro isn't working, we also give oxygen and morphine while turning it into an emergent situation. We even have an acronym for it. MONA. Morphine, oxygen, nitroglycerin, aspirin. All are interventions for a heart attack. When you have a heart attack, your cardiac tissue releases these markers, kind of a distress signal. We can pick these up on a blood test. Sometimes a heart attack can be seen on an EKG. If a patient had a history of negative tests and/or multiple admissions and all their vitals were normal, and I expected they were faking it, I would ask them if it hurt when I put my hand on their chest. They would always say yes, and then I could happily inform them that this likely wasn't cardiac, but muscular pain, since heart attacks won't cause pain when your chest is touched. I would suggest a warm compress and some Tylenol, and their pain was always mysteriously gone within seconds of my announcing that it couldn't possibly be related to your heart. After a while, you do get very used to the signs and symptoms of people actually having a heart attack. There's just no faking that level of panic or the look on their face. Next story. Had someone faking seizures. Would be talking normally, stop, shake briefly, stop, and then peek at me to see if I was watching. I believed it initially until I called the MD and they came in while the patient had another seizure. Doctor picked their arm up over their head, and instead of the arm falling on their face, it changed course to avoid slamming into their own nose. Next story. Not a medical professional, but when I was visiting a small town in North Carolina, I had to go to an ER because of a kidney infection. And I remember out of nowhere, they did this thing where they placed a fist on my kidney and lightly punched it with their other hand, and the pain was so searing and awful that I just screamed and cried. They told me it was to make sure I wasn't faking it for the medication. Oh man, so this is where those sort of unpractical tests kind of backfire. As if throwing stuff at the guy who was pretending to be blind actually was blind and smacked it right in the face. That would suck. I'm in a lot of pain. Prove it. Ouch! Oh my gosh, I told you. Next story. Not a medical professional, but a coworker of mine, let's just call her Linda, because that's her name, was involved in a minor car accident. Her car was able to be driven away, went to the doctors, and must have laid it on thick to try and get some sort of compo payment. Came back to work because obviously the doctor wasn't having her bullcrap, but played the victim for months on end, until I'm guessing her insurance comp failed to pay out, claiming that her spine was no longer connected. I called her on it too. Said, well, Linda, you're doing pretty okay for someone who should be at least paraplegic if your spine isn't connected. She just gave me a dirty look and said, that's what the doctor said. My spine isn't connected at all anymore. And then I just stand there looking at her like, while the supervisor panders to her every need. Oh, don't worry, Linda. Everyone else can pick up the extra work. Oh no, don't try to pick that up. Just sit down. You just relax. Next story. I'm kinda late, but I'm an X-ray tech, and when I was a student, these two people came in. A man who was pushing a woman on a wheelchair with an ankle boot. They both looked like junkies. Anyway, they came in with a prescription for an ankle x-ray. They asked if she has to take off the boot, and I said yes, because obviously it would superimpose on the anatomy. She all of a sudden starts crying, saying that it was too painful. No tears. The man said she broke her ankle in 3 places some time ago, and her ankle becomes curved when she takes the boot off. Okay, dude, ankle x-rays are easy. Take off your shoes and socks, 3 views, boom, done. But no, says she cannot get on the exam table and she needs people to hold her ankle together. We literally had 4 x-ray techs working this high-profile case. 1 to hold the digital cassette, 1 to hold her ankle in place, 1 to hold the chair we had to put her ankle on, and 1 to push the button to shoot. We did this all while she was screaming in pain, and she even said, "Kill me, please." The funny thing, all the x-rays showed no abnormal findings, no old fractures, no screws or any plates or anything of a past surgery. Literally a perfect intact ankle. They wanted painkillers for sure. They looked like drug addicts and had a plan to get more, so annoying. Next story. Had a frequent flyer patient who did have some legitimate medical issues, but you could tell that there was more to it than that. Patient would tell us to push IV narcotics as fast as possible because it works better. Also had the usual, "I'm allergic to every single weaker kind of painkiller, but the good stuff works on me" kind of stories he had. I suspected they were also fudging some admissions information, was making the rounds at area facilities, but that's another story. Patient had to self-catheterize due to a bladder problem, but would regularly come in with raging urinary tract infections. While catheters can cause UTIs, the frequency and severity didn't seem to add up. On top of the other questionable aspects of this particular patient, turns out patient was putting their feces on the catheters before inserting them to cause the infections so they could come into the hospital for meds. Next story. When I wanted to be a physical therapist, I volunteered at one of my local clinics. We had a lady who claimed she was in excruciating pain. She couldn't walk more than 5 feet without literally screaming in pain in the clinic. She couldn't even move her toes without yelling profanities. She kept talking about her meds, how they had ran out and she needed more. She also started talking about how her whole family thought she was an addict, but she swore that she wasn't. I started feeling for her a little. She seemed nice and like she was going through something. But then once the doctor walked out of the room, her and I got to talking about music. I told her my uncle was in a bluegrass band and she mentioned how much she loved bluegrass. She loved it so much that the prior weekend, her and her husband spent 14 hours at a festival. She was so tired of carrying the chairs around and dancing, and they were traveling to go to another one the day after her appointment. When I asked her if she had any pain during the festival, she said, "Oh, none at all. It was a fantastic weekend," and then realized that she gave herself up and got real quiet. Next story. Not a medical professional, but when I was a teenager, I had this friend who would literally fake seizures. At first, we took it seriously because my other friends and I were young and we didn't know any better. She only did this when other people were around to watch and to sympathize with her. We would just stand there and watch. She wouldn't even shake, yet she called them seizures. Eventually, we smarted up and realized she wasn't even doing a good job of faking, especially after she was taken to the hospital. We tagged along because we were sleeping over and we witnessed the doctor telling her patients that he doesn't know what's going on, but her body shows no signs of having a seizure. That person was effing weird. Look, like those ones, it's so unfair. I mean, I get people are going to try and abuse the system, maybe get some drugs, but just doing it around maybe friends or family who won't and can't know any better, that would be so hard, even if I knew you were faking it to like outwardly call your bluff. I would feel like I have to check on you no matter what, because what if this is the one time where the boy who cried wolf found the wolf? Terrible. Just terrible. Glad I don't know anyone like that. Next story. A bit late to the party, I had a patient who was supposedly comatose but was given a few mixed signs when it came to making a definitive judgment. There is a test called a drop arm test, where you raise the patient's arm over their head and drop it. A non-comatose patient will move their arm on their own to avoid hitting themselves in the face. But I had a different idea. With the nurse in the room, I said, "Okay, our defining test. If his arm stays straight up, unassisted, he is comatose." I let go of his arm and it stayed totally upright. The guy did himself in. I told him shortly after that the gig was up and he had no medical reason to be admitted. Next story. Had a prisoner once that was faking full amnesia, including name. I told him there was a nerve in his ear that if he put his finger in his ear and couldn't remember his name, that he was for sure faking it, because it even worked with severe dementia. Finger in ear, remembered his name. Finger out of ear, can't remember who he was. Yeah, insta discharge, back to jail, sir. Next story. Crazy, I actually just got out of the hospital and I'm reading this in bed. I should have gone to the hospital Monday when I had a stabbing pain in my left side that doubled me over and made me puke. But I have an irrational fear that doctors are always going to think I'm faking it and yell at me for wasting their time, so I psyched myself out and convinced myself that I was overreacting, and the doctor would think that I just want drugs or something, but I still felt like crap. So I forced myself to go. The doctor was very nice, and it turns out I had passed a kidney stone on Monday. He sent me home with a note keeping me out of work for the next couple of days and a small prescription for Vicodin. He told me from now on if you're in so much pain it's causing you to double over, just go to the dang hospital. Next story. Oh gosh, I'm a paramedic and I can't count the number of patients I've had that fake seizures or fake being unconscious. It is absolutely sickening. A lot of times it's for family sympathy, but sometimes it's just for attention in general. It's insane. The one test I do that always gets the unconscious ones is the gurney drop. I sit behind them for a minute, long enough to let their guard down. Then I push the lever that drops the head of the gurney back, so they go from sitting to laying in a split second. The moment where their upper body falls out from under them will always elicit the "oh crap" response, where they throw their arms up and open their eyes. Next story. I've worked at the hospital for about a year, so I've only had 2 cases where I knew a patient was faking it. The first one was a young male patient who had an abscess under his arm and demanded inpatient treatment. He did not, and I don't know why he was admitted, but he refused to let a nurse put in an IV, so we had to call RRT, rapid response, to put in an IV using their ultrasound. It was a complete waste of resources. We use this for patients who are old with poor veins. I took him to the shower and he says he's dizzy. I go to walk him to bed with the gate belt on and this man effing drops. It was 100% a fake fall with the way he fell to his side to protect himself from belly flopping to the floor. Then he fakes being unresponsive. We call RRT and the fall team to come in and assess. Fun fact, this patient fakes 3 falls in a week that he was in the hospital. This patient was a complete waste of a bed and resources. He was telling me he was a medical assistant, but now he's on disability in his early 20s? When he walks fine? It's kind of a red flag for Munchausen's. Surprise, surprise, he's back a few months later with the same issue. Surprise, surprise, he falls twice more during his stay. House doctors started charting that they were purposeful and so they didn't count toward for floor fall count. Second one was a few weeks ago. A lady comes in with these pseudo seizures, as she states. She literally said she has fake seizures. Okay, so she's seized in the room. RRT is already on the floor, so they come check it out. This woman doesn't even jerk right. She looks like she's grinding or doing the worm, but in bed, RRT, RN, picks up her arm above her head and she guards. So it's definitely fake. That, and she has no postictal phase. When people seize, it takes them a little while to come back down to earth. She just sits up and whines that she's in pain. She craps the bed on purpose to show me she's in pain, and the PA refuses to order her the dilaudid she's asking for. She asks someone to help her up out of bed to the bathroom, but I popped into the room and told her, because her seizures are and can be so unpredictable, there's no way we can get her up without the risk of her seizing again. Bedpan it is. Next story. Not necessarily faking it, but I work at a clinic and there are definitely memorable patients that have asked if we would fill out an FMLA form for her period week every month. Like if you are actually so debilitated, which can happen, that is definitely something we need to address, and the first step would be to get you on birth control. Didn't want any sort of assessment or start trying treatments, just the form so she could get out of work every month. Unsurprisingly, we denied that one. Next story. Well, not a doctor, but in school a friend had decided he had enough of it for the day and went to the infirmary pretending he was blind. I was in the infirmary for a cut, so I watched the whole thing. At first, he pretended he was blind from both eyes. After the nurse asked how to get to the infirmary alone, he changed to only one eye, the right eye. She goes to get a flashlight, and when she asked again, he said it was the left eye. Then she moved a finger in front of him, and both his eyes made the following movement. She placed a band-aid on his forehead, moved to treat my cut, and said to him, "I fixed your mind's eye. You can go back to class now." Next story. I used to see kids faking it a lot to avoid going to school and doing homework back when I was rotating in pediatrics. Best one was an 11-year-old who had read every symptom of appendicitis and regurgitated it as a medical student would in exams. And he didn't even have a fever, and his USG was normal. I'm telling you, he could have won an Oscar for the acting, though including that small moan when examining the abdomen and checking for rebound tenderness. Next story. I'm a firefighter, and we have quite a few calls about people faking medical problems. The most obvious call that I've ever been on when someone was faking it was a woman that looked to be in her 20s, super drunk. The first call we had was about 1 p.m. We arrived on the scene to this woman having some seizures, but we could easily tell she wasn't because she was making direct eye contact when we were talking to her, and she was even responding to our questions while she was having one of her episodes. We never come out and say you are faking it, but we do ask if you are pretending to have seizures, and if you say no, then we do our best to try and make you go to the hospital. Well, her family and her said that they will just keep her home and watch her, and if it happened anymore, they would take her to the hospital themselves. We had another call from the same address about 3 hours later for the same female having seizures, so we arrive on the scene again, kind of upset since she woke us up for having to pretend seizures again. When we walked back in the house, she was lying on the floor again, flopping around like a fish in a sea of all different kind of alcohol bottles. This time, she gets an attitude with us when we ask her if she was really having a seizure, and we weren't having any of it. My captain got on the radio and called to have a deputy come out and assist us with dealing with the crazy wasted lady. Next thing you know, when the deputy pulled up in the driveway a few minutes later, she was up running around screaming at everyone because she said that we aren't giving her all the medications that we were supposed to give her. So, long story short, she was told she could either go with the deputy to jail or she could go with the ambulance. She said that she would rather go with the ambulance. When we got the stretcher brought inside for her, she started saying that it was all a joke and that we needed to get the heck off her property. But then she got into one of the paramedics' face and started screaming swears at her, so we all got a hold of her and put her on a stretcher and then strapped her down with all the straps just to keep her still. The deputy said we better take her to the hospital just to get checked out. So that is what we did, and she screamed and cursed at all the paramedics all the way there. Next story. Not a doctor, but one night I was in the waiting room at the ER. In hobbles, this girl crying and carrying on like she was dying. She tells the nurse she was hit by a car and she needs a doctor right away. She keeps emphasizing how she needs something for the pain. The nurse even tells her how many people are ahead of her and tells her to sit down. She starts crying even louder. "Ow, it hurts. Please help me. I can't wait that long. I think my leg is broken." Just sobbing and weeping like an actress in a B-movie at best. She carries on like this for a whole hour as more and more people are called up ahead of her. Then she's talking on a cell phone, just loud and obnoxious. "I'm at the hospital. I got hit by an effing car and nobody's effing helping me. Nobody cares that I'm practically dying." Finally, somebody goes in who arrives after she did. She jumps up all mad at the nurse and goes stomping forward and pointing. "I was here before she was. I thought I was next." The nurse just looks down and says, "I thought you had a broken leg." The girl realized that she was busted. She told the nurse to go F herself and stomped right out. Lady in the chair next to me tells me she saw that same girl doing the same crap at the downtown hospital a few weeks before. Apparently she just wants some drugs to sell onto the street. Next story. I worked in an ER, and one day a guy came in by ambulance with his whole family. Supposedly he was having a seizure, flopping around and moaning. Doctor immediately says, "This isn't real, and I don't know why he's doing this." Upon hearing that, he slowly stopped all the flopping and moaning, and he was silent for a second. Then he opened his eyes and went, "Oh, my head hurts." LOL. Next story. If you try and fake a seizure or unconsciousness, we will know. You may be really good at not reacting to pain when I sternal rub or pinch your nail bed, but no one can willingly let their hand drop full force onto their face or not flinch when I suddenly squirt a bit of saline at your face. I don't attempt the hand-dropping thing while in public. It would look pretty bad to make the person slap themselves if it turns out I'm actually wrong. That's the one thing I keep thinking about with all these fake seizure stories. How often are people actually unconscious or having a seizure and they're just getting sprayed with saline, or people are throwing their own hands in their face? I mean, it seems to solve a lot of the issues with these people who are taking advantage of the system, but I can't help but see that as a bit humorous. You come to, your face hurts and you're soaked. You're like, what happened? Next story. Had to take a patient for a test. Patient stalls in every way possible. They even go as far as to say they are short of breath. After checking the row 2 stats, it turns out the patient is just fine. He grumbles as he sits in the wheelchair. This happens quite a bit. Some of these patients act worse than 3-year-olds who have to be in bed by 9 p.m. Next story. My son used to ski like he was indestructible, and he would always get far ahead of me. One time I caught up to him and to find him wrecked and crying. The ski patrol took him to their medical building and privately told me he was fine and he was faking. I made him climb into his bunk bed that night. In the morning, I took him to the doctor just as a precaution. The doctor thought he was faking too, but ordered an x-ray just in case. That x-ray showed he had a broken femur. I felt so horrible, and I don't think I've ever felt any better, even though that was 15 years ago. Listen to your kids, people, and I'm so sorry, little Bobby. Next story. I need to take notes on how to be a successful faker, because apparently telling the truth gets you nowhere. The first time I ever got a migraine, I thought I was dying. Then, when I realized I wasn't dying, I took an Advil, but I vomited it back up. Went to the emergency room to get something not by mouth, and they refused to give me anything. Funny how there was just an article in Science about how they don't take women's complaints of pain as seriously as men's. Next story. So my dad told me a crazy story about when he was working at the local jail as a jailer. This inmate had been acting weird and said he fell and paralyzed himself from the waist down and needed to go to the hospital ASAP. So my dad and another jailer took him to the local hospital that was down the road from the jail, and sat with him waiting to see. He was being really antsy and whatnot, but kept his act up. Then the nurse insisted he needed a catheter just in case because he was unresponsive from the waist down. He hesitated but continued the act. When the nurse inserted the catheter, he winced and howled in pain. Turns out my dad was right. He was faking it, and he paid the price for that one. Next story. I had the weirdest, most terrible back pain earlier this year where I left my left torso and it would burn and just started feeling like it was slowly being crushed and it would eventually affect my breathing. I was so terrified that nobody would believe me that the first thing I'd say to every doctor was, I don't want pain meds, please just help me figure this out. I begged for a blood test because they were so dismissive, and I was terrified that it was pancreatitis or something. It lasted for 2 to 3 weeks. I was told it sounded like shingles, but a rash never materialized, and eventually it got better. If I bend over for a long period, it starts aching in the same spot to this day, but who knows? People who fake these things ruin it for those with real issues. Next story. Seizures are commonly faked at my place of work. There are many different types of seizures. Some can be full body, some just areas of the body, but all are caused by the brain temporarily going haywire. If I lift your arm directly over your face, it should fall directly down as opposed to being guided down to your side, avoiding your face repeatedly. Also, nail bed pressure shouldn't snap you out of it either, but often tends to cure seizures. Next story. What I've heard, friends who are doctors in emergency departments, was usually people saying they had convulsions. A good test was to wait until they had one and give them instructions. Oh, if he really is convulsing, he will, put whatever silly thing you might think, and lo and behold, the patient will pull his hair, roll his eyes, yell right when the doctor says it. Timing, fakers, it's everything. Next story. Glass front building. Watched our patient tear through the parking lot, hop out of the car, aggressively yank a walker out of the trunk, slam the trunk and the car door shut, carry the walker in one hand, strut up to the front door of the building, and the mother effer takes nearly 5 minutes to open our clinic door. hobble in with both hands on the walker, and gingerly sit in a chair in the waiting room. Next story. When I was little, guessing around 9-ish, I started complaining to my parents that my right knee hurt. It was the thigh above the knee, but I called it my knee at the time. For 3 years, my parents told me it was growing pains because it would come and go. The pain was sporadic, but it would hurt while after running or any physical activity, and it would always hurt if you pressed on my thigh. So, I woke up one morning and it ached. Walked in the hallway, dropped to the ground, and faked not being able to walk to force my parents to take me to the doctor. I had some kind of tumor on my thigh muscle. Villonodular something is all I remember the doctor saying. 3 days in the hospital and a 12-inch scar on my leg from the surgery. Sometimes you gotta fake it. Well, this is an interesting one in which he was telling the truth, but they didn't believe him, so he faked it into them believing he was telling the truth, only to find out that he was always telling the truth the whole time. Indeed. Fake it till you make it. Next story. Got called to a house in a not-so-great trailer court for a seizure. Arrived on scene and walked in to see a guy in his 20s on the floor having what appeared to be a tonic/clonic seizure. Think what you see on TV. Immediately, my partner and I start protocol of getting an IV started to give him some anti-seizure medication. I say to my partner, give me the drug back and a setup. I'm just going to give him a dose of the anti-seizure med here, and then we'll get him on the cot. I grab the patient's arm, and magically his shaking slows down and becomes very subtle while I'm starting the IV. Anyone having an actual seizure wouldn't slow down at the mention of drugs, and certainly not when I'm trying to poke them with a needle. At this point, I see his face because he's brought his arms down and relaxed them for an IV/sweet high he thought was on its way. Turns out, I went to high school with the kid. Total scumbag in high school who transferred out after rumors of a drug possession arrest his junior year. As I look at his face, his eyes open for a second, long enough that we definitely made eye contact. Boom. Trigger the shaking to get much worse. Now he knows I know who he is and he really has to sell it. I give him the drug per my protocol and we get him on the cot and into the ambulance. Mind you, he's still seizing, and we are at least 5 full minutes into this call. In my experience, seizures typically resolve themselves in that time frame, let alone with meds on board. There are few, rare instances when they don't. Of course, not wanting to get burned by not treating the guy on the off chance he was actually seizing, I give another dose of the medication and begin to call in my radio report. While I'm on the phone with medical control, they tell me to give a specific dose of that medication one more time with our 5-minute ETA. I acknowledge the order and hang up. Then my partner shouts back to me that it's going to be a huge delay. There's a train where we were in town. There was no way around the train that would have saved us any time as we were right down the hill from the hospital. Going around would have taken longer than just waiting it out, so I call back to the doc and they recommend the same thing, except now it's give that drug every 5 minutes until we get there. That train took a full 5 minutes to pass. Are you guys counting? We are now at 3 doses of this anti-seizing medication, and he is still seizing. He got another one before we even got to the hospital, and he is still flopping like a fish out of water. At this point, he's sweating, slowing down, so I think maybe the medicine is finally kicking in, or he's just really tiring himself out. I tell the doc all about how long he's been seizing, which is well over 15 minutes now, how much of the medication he has on board, vital signs, etc. I then take him outside of the room, tell him about the IV incident and how I made eye contact with him. Doc breaks open smelling salts, ammonia capsules that have such a sharp smell they are used to wake up the unconscious, typically drunk patients, and walks into the room. He breaks one of the capsules and holds it directly under the patient's nose. Kudos to the patient, because he held out for a full 30 seconds before snapping open his eyes and being completely coherent. He looks over at me and goes, "Didn't I go to school with you?" And he recalls my name. I haven't seen this kid in 6 years, at least, and he recalls my name. People who actually come out of a seizure are very disoriented and typically don't even know their own names. That lasts for several minutes to even hours depending on the severity. Needless to say, that patient was discharged that night with no medications or follow-up scheduled. Too long didn't read. Kid I went to high school with faked seizure, got a ton of medications, committed to it all the way to the end, which resulted in sniffing an ammonia tablet and wasting a ton of time in the ER for a workup. he didn't need. Next story. My dad told this story of a lady trying to stay on disability due to seizures. According to him, she was saying some things that didn't line up and didn't make sense to him. Seeing that he isn't convinced, she starts faking a seizure. He takes the pencil he's using and presses down on the nail bed of one of her fingers. She instantly stops and says, "Ow, what are you doing?" My dad responds, "You don't have seizures. Talk to the nurses on the way out and we can set up some tests." His way of saying, "Get the F out of here." Apparently, during a seizure, you can't respond to pain, and certainly can't stop a seizure to ask why the doctor is ruining your phony disability claim. Next story. I keep being accused of faking these gallbladder attacks that I have several times per month. Why? Because my gallbladder was removed 2 years ago after a decade of being accused of faking actual gallbladder attacks. I was in surgery less than a week after finally getting my doctor to humor me and ordered an ultrasound. I have zero clue what's causing the pain because I can't get anyone to run tests. Hospital, doctors assume that because I had an opioid addiction in the past, I must be faking the pain to get killers. Never mind that I'm on Suboxone and that stops opioids from working in my body. Never mind that opioids have never helped me with the attacks. Next story. Had a PT with current glasses correction of plano negative 0.25 times 0.90 OU. Asked PT to take off glasses and look at the chart in the mirror. PT's response was, "What mirror? I can't see anything." If you didn't tell me there's a mirror, I would have no idea there's anything out there. I'm blind without my glasses, I tell you. He was dead serious. As a disclaimer, I don't even think the patient was faking it. I'm pretty sure they were and are just bad crap crazy. And, to be fair, this kind of BS is a very common occurrence. And this was just the most recent interaction. Makes the job increasingly more mentally exhausting every day. Next story. Once, when I worked in psychiatry as a nurse, a female patient witnessed another patient having a real seizure and was brought to the medical floor. She decided to fake a seizure and fooled the other nurses, so she was also brought to the medical floor. Having been cleared of any neurological issues, of course, she was sent back to us the very next day. Disappointed that she didn't have a private room and her own personal TV anymore, she decided to fake another one. So she dropped to the floor shaking. I said to the other nurse, "Look, she has snot coming out of her nose," and she started cracking up. So we canceled the code and I told her, "Better luck next time." Next story. M1 here. One of my professors said that the way that you can tell if someone is faking peritonitis / excruciating stomach pain is to accidentally bump into the examination bed. If they don't flinch or react, then they're probably faking it because true peritonitis is incredibly painful with even the smallest movements. It's also a good way to test for rebound tenderness as well. Next story. Non-medical. I got hit by a car in a crosswalk. Went down pretty hard on top of my bike. Could have had some broken bones and such, but luckily the person hadn't made it up to speed just yet as he had pulled out of the parking lot. Year and a half later, the guy's high school student father sued my mother for damages, claimed it cost $2,000 to get the repairs and wanted $5,000 to cover pain and anguish. Judge looked at him, looked at my mom and me, and was like, "I think this lawsuit is going the wrong way. Case dismissed." Literally a 2-second lawsuit that the dude's father ended up having to pay for it all because he was such an idiot. Real clinchers? 1. He hit me at about 15 miles per hour. At worst, his car had a scratch where his car hit the peg of my bike. 2. I was in a crosswalk and a school zone, meaning I had the right-of-way. 3. I was hit by a white car. The father claimed it was a red car. Next story. I work in urgent care, not a medical professional, but we get a few interesting things here and there. This girl came in with her 2 friends, clearly seems to be in pain. She's holding her jaw, saying that she has a horrible toothache. She has a hospital bracelet on, said she'd been to the ER for this same reason earlier, but whatever medication they gave her, it wasn't helping. She's near tears, pacing. She plays the pain really well. We normally don't prescribe any narcotics, as the people who come in aren't actually patients of ours. We prefer they go to their PCP for things like that. However, the doc working that night was pretty sympathetic towards this girl and gives her a 3-day prescription of oxycodone, like 10 pills. She and her friends go on their way to the pharmacy. Fast forward like 10 minutes, I get a call from the farm verifying that we sent a narcotic prescription. I said that we had, and she replies, well, unfortunately, we can't fill this. According to our system, she picked up a prescription for Vicodin earlier for a different reason. Girl was basically hopping from different urgent cares, getting meds sent to different pharmacies. She was dang good at that acting, though. Next story. Not a medical professional, but I have a friend who is. Worked in a few hospitals in the UK. He said it was quite common for people to fake pain or injuries to get free accommodation at the hospital for a night. There were serial pretenders who were known around the local hospitals for doing this very thing. One time, he got one of them back by calling in a few doctors and nurses. There was a gentleman pretending to be unconscious. He was admitted, but everything seemed normal. One of the nurses rang some of the other hospitals, giving his name, and they confirmed he was one of these serial pretenders. So my friend pretended he couldn't hear a pulse and told the doctors to wheel the man off to the mortuary. They were all in on it. At that moment, the pretender sat straight up, shouted at my friend, saying he was a rubbish doctor for thinking he was dead. Not so unconscious now, are we? Next story. I had a pretty obvious malingerer a few months ago. Pretty young guy, maybe on Reddit, so I won't go into it here. But it did prompt me to pull up a case report on one other famous malingerer. His story was so outrageous he had 4 or 5 unique case reports written about him before someone finally connected the dots. Long story short, he faked having an aortic aneurysm multiple times with CT contrast allergy for attention and pain meds. He had actually gotten someone in Europe to do exploratory thoracic surgery on him, and he had sternotomy, scars up his back, all his story. He did this multiple times all over the US. It was actually super interesting. Next story. I went to school with this girl we'll call Kira. I'm not a doctor, but I am a witness to some serious bullcrap. This girl would straight up just announce to everyone in the room, I think I'm having a seizure. Crap like this was regular, and it only happened during lunchtime whenever she wanted the attention, and she just yelled all this. And then she would proceed to stand up and walk over to the teachers. We were in middle school. She also asked me out the first day I attended the school. Needless to say, I said no. Next story. The bigger question is, how would they know? For 5 years, I had a torn diaphragm, collapsed right lung, part of my bowel and liver through the tear, and a hiatus hernia as a result of a car accident. Oh, and they got the cracked rib, okay. Saw about 10 different doctors. Each one simply looked at my file, decided I was a hypochondriac, and most gave me some pills, which, to be fair, I never took. So maybe it really was my fault. It took so long for one of them to read the radiologist report. Mind you, to be fair, they were busy people, and the report was quite long and had some big words. Next story. I work in the ER. Came into a shift, and the outgoing night doc told me that he just kicked out this guy who pretended to have some sort of abdominal issue, but freaked out and made a scene when they wouldn't give him IV narcotics. He said the guy had a tattoo of his name on his stomach. Not half an hour later, the same guy comes back and sees me and lies about his name. He spells it without a Y on the registration sheet, and I just pull up his shirt and say, isn't that how it's spelled? Then I kicked his butt out. Next story. As a young intern, I saw a few cases of pesticide poisoning. Young guys rejected by their girlfriends would drink some organophosphate poisons and end up in emergency. We pumped their stomachs as the first step by inserting a rubber tube through their nose into the stomach and instilling saline. Usually, they are drowsy and it's a breeze. One guy kept fighting us. We had 2 hefty assistants holding him down. Then he finally said, "Please don't tell my brother, but I didn't actually drink the poison. It tasted so nasty I splashed some of it on my shirt, and here I am. I just wanted to scare my family." Trying to scare the family? Not cool, boo-boo. You guys ever seen Fairly Odd Parents? Next story. Have encountered many drug-seeking patients in the emergency departments where I have worked. Many complain of excruciating chest and back pain. However, show obvious signs of illicit drug withdrawals. Routine cardiac screens come back normal. This is explained to the patients. On a bid to come to an agreement with them, we agreed to administer a potent painkiller, 10 milliliters of intravenous normal saline, pronounced normazaline. They assume this normazaline is a new wonder opiate, and they're often cured immediately. And they walk out. 60% of the time, it works every time. Next story. As a first-year doctor, my boss and I were caring for a female patient with horribly controlled asthma. Nothing we prescribed helped. My boss, however, was quite clever, so while we were both massively failing to help this poor woman, he was ripping his hair out and spending hours doing research into alternatives, admitting very reluctantly he may need to send her to a specialist center. We brought her in for one more round of tests that involved drinking liquid steroids and having hourly blood work to look for a response. I approached her right before her first dose and commented on how the liquid steroids look like pink lemonade, a very light pink color, and explained to her what we were doing. She listened attentively. She was a woman in her 40s, grown kids in college, just divorced. Good job. A short while later, I pass her in the hallway and she's holding her little trash bag that sits next to her bed. It was odd that she was going to throw her trash bag out in a larger trash bin because A, the bag was almost empty, and B, it was the morning, so it was just changed. Out of the corner of my eye, I noticed that in the corner of the bag is a pool of the pink frickin' liquid. I don't stop her or make any indication that I noticed it, but I tell the nurses what I saw and have them bring the trash to me to inspect. I took a picture of her trash bag and sent it to my boss saying, I figured out her diagnosis. I asked the nurses to tell her it's policy to watch patients take their medication for the next few doses. Her blood results magically were exactly as expected after that. Turns out her kid had taken a semester off school because her asthma was so poorly controlled and her kid was worried about her. Attention-seeking behavior 101. Next story. I work in X-ray and had a patient who was insistent that he was in such horrible pain he could not get off the stretcher for this exam. This is not a problem. We do imaging in the bed all the time. But this individual was 400 pounds and wider than they were tall. By not having gravity on my side to maneuver their excess soft tissue out of the way, meant I got horrible and most likely non-diagnostic images. Upon returning the patient to their room, before I could park the stretcher or lower a side rail, this guy hopped off the end of the bed and ran out the door stating he needed to use the restroom. I was left standing there, drenched in sweat from having to move this heavy guy around by myself, and was feeling like I had to start on a hernia or 12, and this guy just hops up like nothing was ever wrong. I gotta tell you, I still harbor some level of hatred for that guy. Next story. One of my early days as an ER intern, I had this guy who had a hemophilia, a very low percentage of factor VIII, very high risk of intracranial bleeding. He claimed that he was at work in a building but had collapsed through 2 floors and hit his head. He was confused, disoriented, high concern for trauma. Anyway, a few minutes after telling my attending, he's trying to grab my attention, "Hey man, can I get something for my severe headache?" A couple of calls to speak with his hematologist in the other side of the city. "Oh, so how many floors did he fall from today?" Next story. Was finishing up my EMT training this past November and was doing ride time. This was my last day of ride time. Only needed a few more patient contacts and we were coming to the end of a 13-hour shift. We went out to one of the busier areas for a wreck, but another truck ended up taking the call, so we started to turn around, but then immediately got another call for another wreck in about the same area. The 2 women were at a stoplight and it had just turned green and they literally just started going. Couldn't have been going more than 5 miles per hour because they only moved like 10 feet. One lady rear-ended the other and they both pulled off into the median. The lady who got rear-ended started complaining that her neck and her back was hurt, so the other one called for an ambulance. We got there and go to the lady with the neck pain who is still sitting in her car. We ask her all the basic assessment questions, and she's moving her head around freely the entire time. Says it just hurts when you touch it. These cars didn't even have paint transfer or any sort of damage. There is no way this lady is actually hurt. But obviously we can't say anything. We just call her and load and go. I felt so bad for the girl that rear-ended her. She was freaking the F out thinking she actually hurt that woman. Next story. Not a medical professional, but a handicapped individual. I started experiencing back pain when I was 16. I used to spin, dance, Rifle, flag, play soccer. I was working out and practicing a minimum of 20 hours a week. The new doctor I started seeing told me that I was too young to have any back problems, despite back problems existing on both sides of my family, and I needed to exercise more. When I restated that I was extremely active, more so than most teenagers, she just said some BS that quality over quantity and should put more effort into it. Sounded like she was thinking I was simply leisurely walking and not freaking doing sprints and weightlifting marathons. She wouldn't do any of the imaging, and I begged for it. My mom didn't back me up because the POS doc told her I was just faking it all. Makes no sense why I would have faked it, considering my dream was to become a professional dancer, and I didn't even understand that people would go into faking injuries for drugs. I was so naive. So I wasn't drug seeking. Turns out I had a hairline fracture on one of my lower vertebrae, and if I would have eased up on the intensity or stopped dancing, I wouldn't be as messed up as I am now. 3 compressed discs, bone spurring, arthritis, and scoliosis is what my last MRI result at the age of 25 showed. Plus all my joints are pretty much crap now. Not only can I not dance anymore, but some days I can't get out of bed for work or school due to pain. I've suffered from depression, social anxiety, general anxiety, which were all shrugged off by the same doctor and not diagnosed until far later. And for most of my life, the dance was the one thing that helped me handle it. My mom voiced her regret for not fighting for me years later, since I could have been better off. Even after finally not having to see that first crappy doctor, I still received doubtful voices from just about every other doctor. So much that whenever I see a new medical professional, I personally bring my medical history file, which includes my MRI results. I've even had some female dog that was a maintenance worker at one of the medical buildings I was going to for my physical therapy come up to me with another lady when I was getting into my car and started trying to berate me for parking in a handicap spot. I've gotten it down now to where you can't really tell I'm limping or walking funny unless you really pay attention. So as long as I'm not having a really bad day. However, I was walking slow as a snail and limping that day. PT kicked my butt. On top of having a horrible mental day, and since my therapist said I wasn't showing any progress despite the 6 months I had been working my butt off, I screamed and cussed so loud at both of them that the secretary from my PT office rushed outside, terrified. I honestly wish I could beat the crap out of any lowlifes that fabricate their pain or illnesses, since it makes a life a lot harder for people like me. So for scum like that, F you. For medical professionals, don't always be so quick to judge. Next story. Forensic psychiatrist. I do a lot of evals for people in criminal cases and see malingering at least once a week. The most obvious fakers are the ones that draw attention to their symptoms. They will quickly look around the room and say, "Don't you see that?" I often reply with, "Why wouldn't I?" instead of some form of "see what?" and it throws them off. When they are reporting delusional thought content that they clearly don't believe, they will nearly always qualify it with something like, "I know it sounds crazy, but..." A person who has a true delusion does not think that delusion is crazy and would not draw direct attention to it. Just like we don't go out of our way to state the obvious, tomorrow the sun will rise, hey, ice is cold, etc. A delusional person doesn't generally go around saying, "I'm the son of Osama bin Laden and Marilyn Monroe." Generally, unless you ask them, because to them it is obvious and wouldn't necessarily come up organically in conversation. Lastly, as a general rule, be on guard when anyone ever starts a sentence with, "honestly," or "to tell you the truth." Disclaimer, these observations are not 100%, but are useful flags that someone may be lying to get out of going to prison, based on my experience. Next story. Dentist here had a patient who was scared of getting any kind of sedative or anesthetic because she didn't want to be numb and was scared of being under general anesthesia, pretended to have a seizure when she was told that her treatment would be too painful otherwise. Pretty sure it was an act because no seizure ever is just shaking of the person's hand and feet and head from side to side. Honestly, looked like a child throwing a tantrum. The seizure also miraculously went away when I said I couldn't do any kind of treatment in that condition. Aw, see, I kind of feel for this person. I mean, it's different for trying to get attention or get something out of it, but, I mean, you're faking it out of fear. You're trying to get out of a situation. And I feel you, sister. I'm also scared of the dentist. Next story. I'm a criminal defense lawyer. I had a client who, when caught dead to rights on charges that had a 15-plus year mandatory minimum, decided that he was incompetent to stand trial. Despite having over a dozen prior felonies and spending much of his adult life in courtrooms, he suddenly didn't know the difference between guilty or not guilty, couldn't figure out which person in the courtroom was the judge, and generally just pretended like he was profoundly low IQ. Grudgingly, we call in a psychiatrist for a competency evaluation. The shrink realizes immediately that the client is faking, but that he's smart enough to be faking in a way that isn't objectively verifiable through any of the standard methods. So, the shrink improvises and gives him a 100-question test on courtroom procedure. The client gets 0 questions right, but it was a true or false test. The odds of getting every question wrong if you were genuinely trying are astronomically low, even when one of the questions was true or false. The bailiff's job is to hand out balloons. By getting every question wrong, the client had proven he knew the answers and was malingering, and therefore proven his competency. Next story. I used to be a firefighter/EMT. When I was doing my EMT certification, I had to go on ride-alongs. It's getting to the end of one of them, and we get this call for a woman with severe abdominal pain. We roll into her apartment, and she's sitting on her couch dressed like she is about to go shopping with her purse in her lap. We start looking her over, doing vitals and getting the info we need, and load her into the bus. She doesn't want to go to the hospital, A, because she was just there a few days prior, and they didn't give her the meds she asked for. That told us she was just trying to get the pain meds. So we redirect to Hospital B, which is a much busier hospital per her request. During this whole time, she is super sweet and grateful to us. We get on the horn with the hospital letting them know we are on our way, and they let us know where she is going, which was the waiting room, with everyone else. We tell her this, and her whole demeanor changes, and she becomes bitter and threatens to sue us, says some pretty vicious things at us, and I can only imagine the look on her face when the other doctor was able to see not to give her pain meds from the former hospital. The things we do for drugs. That's pretty annoying, especially for all the people who are dealing with some real things out there. But anyways, guys, outside of that concludes our stories of people ridiculously wasting time and, trying to take advantage of the doctor system. But I want to say thanks for hanging out with me. And 2, if you have any sort of astronomical, bizarre, weird stories of different patients or doctors or whatever you want to share, really, feel free to drop those down below in the comments, because obviously we like reading them. We like hearing about some strange stories. And we will see you in the next one.